Hello, my name is Dr. Ray Nickel. I'm an orthopedic surgeon with Ventura Orthopedics.
And my name's Carrie Odenath. I'm a PA and I work with Dr. Nickel.
What we are going to show you today is how to do a special stretch for your Achilles tendon. Why? Because we see a lot of patients who have problems which are in large part due to their Achilles tendon being too tight. These include common problems like plantar fasciitis and Achilles tendonitis, but there's also increasing thought among the medical community that a tight Achilles tendon may also contribute to other foot problems as well. Most of you who will view this are doing so to treat a specific problem like plantar fasciitis. I would encourage you perhaps to look at these exercises not just as something to treat your current problem, but also as something that should become part of your daily routine to some degree. When you brush your teeth, you don't do it because you love the feel of the bristles running over your teeth. You do it because it keeps you from long-term problems and big dental bills. Kind of look at stretching routine as part of that same process to prevent something from occurring down the line. First of all, let's review some anatomy with the help of Carrie here. When she goes up on tiptoe here, there's the gastrocnemius muscle and the soleus muscle. The Achilles tendon is a thick cord at the back of the ankle, runs up, and as it goes up it widens, but it also becomes thinner. You can come on down, Carrie. The gastrocnemius attaches to the back of the thigh bone just above the knee and on the top surface of this wide thin sheeting. And deep to that, the soleus muscle arises off the shin bone and attaches to the deep side of the sheeting. The soleus muscle is felt to be the primary muscle that affects the tightness of the Achilles tendon and therefore is the one that we most want to stretch. How we do that is by doing a bent knee stretch, which takes the gastrocnemius out of position and therefore just works on the soleus muscle. We're going to do this today on the left foot since it's this side. So the side that we are not going to stretch goes up to the toes right there. This is best done with the socks on or barefoot. The easiest way to do it initially is to stand facing a vertical surface like this, and the way you position yourself is going to be key to doing this stretch correctly. You want to place your left foot now back so that it's back about 12 inches back from the wall. A rough way to think about it is that the tips of the toes on the side you're stretching should be even with the heel on the side that you're not stretching. Secondly, you want to now roll your heel to the outside a bit so that a line through the Achilles tendon and the second toe is pointing perpendicular to the wall surface. This locks your arch so it doesn't collapse when you do the stretch, and so the force gets transferred to the Achilles tendon. Finally, you want to stand so that your back is very straight and parallel to the wall. Notice Carrie's head is over her shoulders, is over her pelvis kind of deal. The way you do the stretch now is that you start by bending at the hip and the knee, and it's almost as if you're keeping your back straight or even a little bit of a sway back position. What you're trying to do basically is to touch the front of your pelvis up against the wall here. Continue this maneuver until you feel the tightness in the lower Achilles tendon, not to the point that the heel comes off the ground. You want to hold this position for 30 seconds. You want to then switch feet and repeat the same process on the opposite side. For an acute problem such as plantar fasciitis, we recommend doing these stretches 10 repeats on each side twice a day. It's going to take you about 15 minutes in the morning, 15 minutes in the evening to do this. But you can't overdo this stretch in terms of doing this too many times a day. Once you've learned how to position yourself, you can do this without the need for a wall for reference and can do it while you're waiting for the coffee to be made, for a call to come, all those kinds of things. When we question our patients about how they're doing on the stretch, they tend to make one of two mistakes. One, they forget to pivot their heel to the outside like that, so that when they're going down, they're basically flattening their arch, whereas if they pivot it to the outside, they lock the arch and the transfer of the force gets done to the Achilles tendon. The second problem is that they tend to go down and they put their bottom out too much rather than trying to just take it straight and touch their pelvis straight forward. We hope this video has been helpful. If you have any further questions, please do not hesitate to contact us. Good luck with your stretching program.